Well, hello and good morning. It's Monday. It's chilly. Oh my goodness, we're getting into the fall. I can feel the difference. And I know if you are in the mid Atlantic or the Northeast, you're probably feeling what I'm feeling as well. But it's great to be alive, right? It's awesome to start a new work week and to think about the possibilities of interacting with your child and helping your child develop at the level that you would want him or her to be. This is Dr. Yonnette with another episode of Baby Talk. So today we are talking about learning disabilities or learning disorders in children. And the information I'm sharing is going to come from the CDC. I want you to listen carefully, moms and dads, because sometimes it takes us a while to really acknowledge, that's the word I'm looking for, acknowledge that our child is struggling a little bit and then reach out for the help that we need. Because there are many children in schools with some skills or abilities that they struggle with. And when they try to overcome that struggle, you are noticing that over time they still have those difficulties. And then is when you want to cue into understanding that your child is probably having a learning disorder. And a learning disorder means that the child has difficulties in one or more of the areas of learning, even when overall intelligence or motivation is not affected. Okay? So your child can be smart, but in one area he is struggling, really struggling. Here are some symptoms that you need to look for when you're trying to determine if your child has a learning disorder. The child has difficulties telling left from right. The child reverses letters and words or numbers after first or second grade. A lot of people come to me and say, oh, the child is still reversing his letters or numbers. But you need to look for, if the child is still kindergarten and first grade, you want to, give the child a chance to develop. But if it goes past the second grade, then is when your red flags should go up. The child has difficulties recognizing patterns or certain items by size or shape. The child has difficulties understanding and following instructions or staying organized. They may also have difficulties remembering what was just said or what was just read, and they lack coordination when moving around. They may have difficulties doing tasks with their hands, like writing, cutting, and drawing, or you may see difficulties with understanding the concept of time. Now, there are a number of learning disorders. I want to point out a few of them today. And the three of them I'm identifying are dyslexia, which is difficulty reading, dyscalculia, which is difficulty doing math, and dysgraphia, which is difficulty writing. So if your child has a learning disability, he or she may feel frustrated from time to time that they cannot master a particular subject, or even though they're trying so hard, they're having such difficulties. And they can present, because a child is struggling like that, learning disorders can result in emotional or behavioral disorders, such as attention deficit hyperactivity disorder or anxiety. And when you combine these problems, it makes it the problems would make it very difficult for your child to succeed in school. So you want to make sure that you are journaling and you are seeing what's happening in your child, and you're bringing it to the attention of professionals who can help you with treatment, diagnosis first, and then treatment. What are some of the treatments for learning disorders? Children with learning disorders need extra help. they need extra instruction, and they need instruction that is specialized for them. So if you have a child with a learning disorder, you can have that child receive special education services in school by having the school professionals come together and develop an IEP plan, or a plan that includes the family. And parents, you need to know that whenever your child is in that situation, under the Individuals with Disabilities in Education Act, you are given the opportunity to get these services, and your child should not be discriminated against because of these disabilities. Okay? So, as health providers, we are going to work with your child to identify children in early intervention or special education services who need support. And we are going to share relevant information so that the school personnel understands the needs of that child and works with him or her using appropriate strategies. And then we are also going to make sure that when you use the intervention and information from your doctor and bring that information to us, we will incorporate it into what the child needs and what we provide for the child in the school setting. So I always like to harp on early intervention. Make sure that you are identifying these learning disorders in your children very early so we can address them. A lot of times, just strategies, giving the child strategies, will help him or her succeed. It's just a different way of teaching the child the information. And if we know that these are the difficulties that a child is experiencing, then we can address them. So this is Dr. Yonnette coming to you again with another episode of Baby Talk. Today I talked about the older kids. I want you to take care of yourself. Take care of your skin. Take care of your knowledge. Know what is there. Don't go to a meeting or don't go to your doctor's pediatrician without knowledge. But that wouldn't describe you, because you've been journaling, you have been following along with me, and we have been learning so much about how to take care of our children. So do a good job. Get the information you need. Take care of yourself so you are happy and prepared, and take care of baby. Shout out to baby Dominic as he turns 4 months old today, and have a blast of a Monday.